Hello. Welcome to Substance Use Services and Resources. My name is Kathy Maycumber. I am part of the team from Michigan State University, presenting this series of videos that cover various aspects of what is generally called telehealth. This is Part 7, titled Substance Use Services and Resources. In this video, we are going to describe different types of services and resources that are all considered part of substance use treatment in telehealth. In this presentation, I will cover a number of aspects of substance use treatment in telehealth. I will describe what substance use is overall. This applies to any treatment setting. I will also define co-occurring disorders, as these are common when treating substance use disorder. I will talk about how telehealth can address substance use and co-occurring health disorders, and what types of treatment you can access through telehealth. I will describe treatment providers and end with some national and state resources related to mental health and substance use disorder. I will also show you a brief video which illustrates a typical substance use disorder teletherapy session. Substance use refers to the use of selected substances, including alcohol, tobacco products, drugs, inhalants, and other substances that can be consumed, inhaled, injected, or otherwise absorbed into the body with possible dependence and other detrimental effects. A substance use disorder is a medical diagnosis that indicates the use of substances is interfering with a person's ability to effectively manage their life or health. Co-occurring disorders refer to the presence of two or more health conditions at the same time. These can include mental or physical health conditions and/or substance use disorders. These conditions interact with each other and affect a person's health outcomes. Telehealth can be a safe and convenient option for getting substance use and co-occurring disorders treatment at home. You may be able to attend appointments without needing transportation, taking time off of work, or arranging for care for someone you are responsible for, perhaps a child or spouse. These factors can be important in a long-term treatment plan. You can participate in one-on-one therapy, group therapy, text therapy, medication-assisted treatment, other medication prescribing, referrals, and more. Substance use disorder treatment can be done in a variety of ways. We will go through each briefly to point out the specifics of telehealth with substance use disorder and co-occurring disorders treatment. Often, individual telehealth for substance use disorder is a good way for persons dealing with substance use to gain treatment in the privacy of their own home. Individual substance use treatment via telehealth will often include work with multiple treatment providers, therapists, medication prescribers, and peer support, individuals with special training and experience with substance use disorder and recovery. Other possible treatment providers include occupational therapists, registered dietitians, and pain specialists. Individuals who have health concerns in addition to substance use can use telehealth to address those concerns as well, often during the same appointment. This interprofessional treatment approach to substance use disorder via technology can gain access to healthcare professionals you might not otherwise be able to see. Individual, one-on-one telehealth is the most common form of telehealth that may be able to be performed through video or audio-only telehealth services. It can offer privacy and convenience, including reduced travel and disruption to daily activities like work, travel, and care for others. in addition to easing the stigma of going in person to a clinic or office. You can access individual telehealth in multiple ways. Virtual talk therapy helps address both recovery and any co occurring mental or physical health concerns. Telepsychiatry is where you can get prescriptions and manage your medications. Online apps can help with tracking and monitoring your mood, as well as coping with problems. There are a few websites included in the references at the end of this video presentation that may be useful. Text therapy allows you to communicate with a healthcare professional at any time. Group telehealth for substance use disorder can be accessed both online and via telephone. Many peer recovery groups and 12-step programs now provide the convenience of meeting in groups using technology. As with individual therapy, this can provide for significant privacy when seeking treatment for SUD. When used in combination with other treatment methods, telehealth interventions can be part of a cooperative, integrated approach to treating substance use and co occurring disorders. You can get care from your home instead of a public clinic, have access to providers who understand substance use disorder, and choose to continue care with your regular individual or group therapist or healthcare provider while receiving treatment. Speaking with a healthcare provider while at home can also allow your provider to see how you are managing treatment in your home environment. Telehealth.hhs.gov has patient resources to help you learn more about what telehealth services are available, find out how to access telehealth services, and determine associated costs so you can use telehealth to manage your healthcare needs effectively. Let's watch an example of individual telehealth for substance use disorder. The therapist sets homework for the patient and then walks through the homework exercise. You can hear the way the patient was able to participate in a private way and that the patient is able to speak freely in their home environment while on a lunch break.
Hey, Michael, this is Sean.
Oh, hey Sean, how are you doing today? Good to see you.
Good, good. I made it on time again, huh?
Yeah, this is the third week in a row. You're 1 o'clock promptly. Yeah, that's fantastic. I'm really glad to see that. So
Yeah,
we got
I
some
know.
structuring going on already with your punctuality here. I like to
Well,
see.
it's true. I was doing a little bit of work, and I told my boss that I need about 15 minutes to go call call my important person, and of course they don't mind. So I did. They don't know what I'm doing, but so anyway, I called, and yeah.
Yeah,
So
I'm glad you called. I'm glad you. So you're at, are you saying you're are you at work right now?
yeah, but I got a quiet spot. I pop back into my house, and I got a few minutes here, and then I'll go back out to work in a little while. So I'm just back home for a little bit. I got a kind of a lunch break, and I can do
Gotcha,
that.
gotcha. Okay, well let's jump right into it if you don't mind.
Sure.
So were you able to remember last week we talked about the journaling exercise with the triggers?
Yeah, yeah,
You were going to write down some triggers and we were going to talk about some cognitive restructuring processes. So if you don't mind, in the time that we have today, what's triggering you the most right now? Would you say out of the triggers? Well, first, would you mind just telling me the triggers that you wrote down?
well, it's kind of interesting that first of all, you said what triggers you the most, because I
Yeah,
wrote down about 5 different triggers. I took some time, and I said, okay, what's my day look like? And I kind of wrote those down. Um, but I'll tell you which one that really gets to me, if you don't mind,
sure, sure.
is in the mornings, I still got to ride my bike to work. And, so that's first I get triggered because my back hurts, and the injury was on my bike. And so my back hurts like hell. And, it's really hard to get on the bike. And then I'm a little anxious and nervous, and a whole bunch of other stuff. But the other one is I, I always ride by where I used to get my dope. And so I ride by there and I'm in pain and I'm seeing my dope dealer and boy, my head just goes crazy. And by the time to get to when I get to work, all I could think about is getting high. And it's kind of a bad deal.
Privacy and confidentiality are major concerns in any online healthcare environment. These issues are ones that are the responsibility of both the healthcare provider and the patient. The healthcare provider will often provide a link to a secure website that the patient can click on or enter. Online platforms like Doxy and others are specifically designed for healthcare treatment with layers of privacy settings that limit the risk of exposure of healthcare information. Privacy and confidentiality are also the responsibility of the patient. Making sure you are in a private space with few distractions is important. Engaging in telehealth appointments in a public area or with other people around puts your privacy at risk and should be avoided. Think about privacy and confidentiality online similarly to how you do in an exam room at a doctor's office. Sometimes you can hear other patients through the walls, and sometimes you catch glimpses of other patients' information. These are often not intentional and are the things the doctor and their staff try to limit. Similarly, the doctor and their staff work hard and have to follow a lot of rules to keep you and your information safe online. Medications for substance use disorder and any co occurring mental or physical health issue can be done using telehealth. During the pandemic, many of the restrictions previously in place to limit the prescription of medications through telemedicine were changed. Many of those changes have remained in place, including those for medications for addictions treatment and those for co occurring mental health disorders, such as antidepressant and anti anxiety medication, as well as physical health concerns such as diabetes and heart disease. There are a number of healthcare professionals who use telehealth to treat their patients. Providers you might work with include peer support. This refers to help from someone similar to you who has experienced substance use disorder and treatment. A therapist could include a clinical social worker, psychologist, or counselor who has specific training in treating substance use disorder and is licensed. This person can diagnose substance use disorder and can bill insurance. Nurse practitioner is a nurse with advanced training who works with a physician to practice primary care. You would look for one with specific training in substance use disorder treatment. A nurse practitioner can prescribe medication. A psychiatrist is a medical doctor with advanced training in psychiatry. The specialist typically addresses severe mental illness and can diagnose, prescribe, and treat substance use issues. They do not typically do therapy. A physician is a medical doctor, perhaps a primary care doctor like your family doctor, or a specialist in pain or substance use you are referred to. They can diagnose, prescribe, and treat. They typically do not do therapy. There are many resources available to help with mental health concerns. The Substance Abuse and Mental Health Services Administration Helpline is a national resource. The 988 number is more than just a number to call if you are feeling suicidal. It is also for individuals who need help and resources for themselves or others. Sometimes substance use issues can be linked to abuse of some kind. This number can link you with resources related to physical and mental abuse, as well as for those experiencing financial abuse. It is pretty common for financial abuse, where a relative or a friend takes advantage of your generosity or feelings to get money from you, to occur with older adults. Understanding that you are at risk may help you determine that you want more information or help, and this number can be called just for that purpose. To sum up our key takeaways, telehealth can be a good way to access substance use and co occurring disorder services. Telehealth has many benefits, including convenience and privacy. You can access many different services through telehealth, including a variety of substance use providers and medication. Okay, are you ready for the learning check to help you see some of what you have already learned? You don't have to turn in your answers. Just think about it, and then we'll look at the next slide for the correct answers. These are true-false questions. Here we go. True or false? Telehealth can give you access to individual therapy for both substance use and co occurring disorder services. Second question. True or false? Peer support for addressing a substance use disorder is available through telehealth. The correct answer for the first question is true. You may receive these services through telehealth. The answer to the second question is also true. Peer support, working with someone who has experienced substance use disorder, is available through telehealth. Thank you for watching. Please be sure to comment to help us improve these videos.